I'll read this chest X-ray today. So this is a chest X-ray PA view of a 53-year-old gentleman, a well-centered and well-exposed X-ray. The bony cage and the margins appear normal, and over the lung fields on the right side, on the mid and lower zones, there are well homogeneous opacities with the upper opacity has a clear margins and the lower opacity has a hazy margin, and the costophrenic angles on the right side is more obliterated, and there is a there is evidence of a subpulmonic effusion here, because this is the gastric shadow, this is the gastric fundic shadow, and this is the lower lung shadow. Usually there won't be this much distance. Usually the distance between the lower border of the lung field and the cardiac then the fundic shadow bubble will be usually like only 1 to 2 centimeter. If this distance is increased, always you should suspect any evidence of subpulmonic effusion. Okay, so in this patient there is a subpulmonic effusion, and also there is a obliteration of the right costophrenic angle, and also in the lateral view, if you see, the same opacity, upper opacity is having a track here. Can you see that? It's like a small tail. This is also a small tail. Okay, and also this lower opacity, what you are seeing is actually here is this opacity. It's something like some form of this form of opacity you are seeing, like a haziness here. Okay, so so what are the differential diagnosis? And also the main thing is there is a cardiomegaly here. There is a clear cut cardiomegaly. The cardiothoracic ratio appears around 60-65% in the PA view. So whenever there is a cardiothoracic ratio of more than 50% in the PA view or more than 60% in the AP view, that is cardiomegaly. Okay, so in the background of cardiomegaly, you are seeing a well-defined homogeneous opacities, and this probably could be a fissural effusion. And the lateral view, it clearly confirms that it's a fissural effusion, because in the horizontal fissure there is accumulation here of fluid, and also you can see a tail here. Okay, and here also it's accumulation along the fissure. Okay, so I'll show you one diagram. So this is the usual location of this horizontal fissure. Okay, and this is the usual location of the oblique fissure. So whenever in heart failure patients, when the pulmonary venous pressure, it means usually in the left heart failure patients, whenever there is a overload and all, there will be formation of a pleural effusion. And also these pleural sometimes and yesterday someone is asking me like there is no much evidence of the cephalization, so there need not be, but in this case the pleural effusion is maybe clearly missed, because the costophrenic angle actually appears somewhat sharp only. Someone may think like these are some malignant tumors or metastasis. So but you should clearly see, this is very important, that the distance between the funding bubble and the lower end of lung field is increased, indicating a subpulmonic effusion. So you should always think of a subpulmonic effusion. And also based on the location, so see, this is the fluid accumulation in the horizontal fissure, and this is the fluid accumulation in the oblique fissure. So here you can see this is the horizontal fissure, usually it will be along the fourth intercostal space, and this is the oblique fissure. Okay, so this is the chest X-ray of a heart failure patient, giving a forming collections in the fissures, giving a appearance in the form of a tumor. So these are called phantom tumors. So these are called phantom tumors in a heart failure patient. And so, and you should always tell a differential diagnosis, not only single. You can also mention it can be a metastasis also. Sometimes a cannonball metastasis may appear like this, and a localized consolidation, usually it won't have this much sharp margins, but definitely this can be a consolidation. So you can always give a differential diagnosis, or else you can give a differential diagnosis of a fluid filled cyst also, a fluid filled cyst within the lung. So this is not within the lung, these phantom tumors are within the foldings of the pleura. So these are all the differential diagnosis for this phantom tumor. So in the lateral view you should always see for the tailing of this. So here you can see the tail, here also it's forming along the fissure. Okay, so these are the very careful these findings you should all carefully observe any heart failure patient. And also, so these also an evidence of LV dysfunction. Whenever there is a cardiomegaly, you should always suspect associated LV dysfunction and associated uh, findings. Okay, so this is an interesting X-ray for today. Okay, thank you.